AM 1430 KRGI 105.5 FM. Good morning. I'm Brian Gallagher. We have a guest in studio from Central District Health Department. Jodi Garretson's here to talk about your heart, my heart, everybody's heart, because it's American Heart Month. Welcome back.
Thanks, Brian.
Let's talk about heart.
Yes. So as it's American Heart Month, we wanted to focus on the heart. And one of the biggest pieces of that is our blood pressure, the things that we can do to manage it. And just maintaining a good blood pressure helps us to keep a healthy heart.
I'll admit, for years, I was on the verge, on the high end of the scale for, blood pressure. And in fact, when I kept going to the doctor, he would just say, you're right there, but it never moves. It just never changes. So that's good. Well, as I get just a little bit older, he said, let's just try this. And so he put me in a low-dose blood pressure thing, and it instantly came down, just like that. And, I haven't felt any personal difference, but yet it just seems like it's given me a little more peace of mind.
Yes. And
apparently when I go back, he doesn't talk about it anymore, so it's peace of mind for the doctor, too. So yes. I guess that's good.
Yeah, so sometimes that's what people need is a little bit of that medication just to bring it down. The thing about blood pressure is it's most of the time, the only way to know it's high is by taking it. Typically, people don't have symptoms with high blood pressure, but over time, running at a high blood pressure causes more and more stress on the heart that eventually is going to come out in some kind of symptoms at some point.
And some of those symptoms can be troublesome, stroke, things like that. Yeah, it's a problem.
Yeah, definitely stroke, heart attack, things like that. So we definitely want to maintain that while we can.
Is this something that if people don't know, how often should they be checked? Is it annually? Is it semi-annually? What's recommended, especially if folks have not had signs of blood pressure issues before?
Yes. So if someone has a healthy blood pressure, which is, under 120/80, then typically the American Heart Association recommendation is every other year. Now, as we get older, we're probably going to need to be taking that more often than that, and especially if it has run higher, above 120 above that 130 over 80 can get into high blood pressure if it's continuously there. So people need to be taking that more often at that point for sure, and following your doctor's recommendations.
And as far as diet, is it food choices that still have an adverse effect on that potentially?
Yeah, so the things that make a difference on our blood pressure are definitely the foods we eat make a difference, maintaining, staying within recommended amounts of sodium, and just eating good amounts of fiber, so fruits and vegetables, whole grains, that makes a difference, that helps. The amount of physical activity we're doing, stress, if you smoke, it's recommended obviously to stop smoking, can make a difference. Those are the things that make a difference in maintaining good blood pressure.
Jodi Garrettson's here from Central District Health Department talking about American Heart Month and the things that we all can do to try to improve our heart health day by day by day. One thing that still hasn't gone from our consciousness and obviously from our life is the current situation with COVID-19. The Omicron virus seems to be dissipating a bit, but we're not out.
Yes. Yeah, we're still seeing COVID, so it's still important to take precautions, and we still are giving the COVID vaccine. Recommend that for anyone who hasn't received that. And
you have the NOMI testing outside still?
Yes. So the company NOMI is doing the testing out in the parking lot of Central District Health Department. They asked that for registration, and that is on our website. So you can go to our website, and there's a link to register for COVID testing if you're having symptoms.
cdhd.ne.gov?
Correct.
See, the old guy can remember some stuff.
Good job.
I haven't forgotten all of it. All right. If folks have a question, though, what's the number they should use to find out more?
They can call us at 308-385-5175. Okay. And just ask us any questions about anything that we talked about.
Take care of your heart, Jodi Garretson. Thanks.
Thank you, Brian.
Good morning from AM 1430 KRGI 105.5 FM.